Hey guys, welcome back to Contest Prep University. I'm Joe Klemczewski with Adam Atkinson. We're in episode 5 of our series on GI pathologies. And this time we're going to really talk about the serious pathology side, Adam. Everything up until now has been kind of leading toward, what's the most, serious thing that you can deal with. And if you let these symptoms and these problems progress, you can end up with ulcerative colitis or even something like toxic megacolon. Everybody likes to talk about Crohn's disease and celiac and things like that. Everybody thinks they have gluten intolerance. But I want to talk about what these really mean and when you may or may not want to seek some attention. So everything that we talked about with eliminating certain foods and trying things to try and get rid of those symptoms, what if they just don't go away? What if you just cannot shake that? Then obviously our stance is going to be go to your doctor. Your family doctor is probably going to refer you pretty quickly to a gastroenterologist. And I don't think everybody just reflexively starts scoping people from end to end, but they're gonna at least put you on the radar, look at some things, and maybe run some tests. And you can end up having some serious food allergies. You may be one of the few people who really does have a true celiac issue or Crohn's disease type condition. In that that is an inflammation of the small intestine. And so all of a sudden now those tissues are going to be so inflamed that you do have malabsorption issues. And, some of the terms thrown around are like leaky gut syndrome, where there's extra permeability. That can be one issue. And then your sedimentation rates go up. You're literally getting, microbial, crossover contamination in your bloodstream, as a possibility. But this is where you really do have to, just bite the bullet, go to the doctor and see if there's an issue, even though that's very difficult for me to say because I don't like to just send people running to the doctor every time they think there's something wrong. But have you, Adam, seen somebody that was just having some issues and they wouldn't resolve, and then they really did find out they had a big issue to tackle?
Yeah, absolutely. So there's a lot that can happen. Your veins that actually feed your digestive tract can actually get bound up, and you can end up with part of your colon that actually starts dying off. And that's not necessarily anything from your diet. There's a lot of malfunctions that can happen. But I had a client who was losing blood supply to her lower colon, and she was definitely having some major issues. It was not from her diet. It was something hereditary. And once they cleaned that vein and was able to open it up, obviously everything got way better. But when you do everything from a food perspective, it's just, I would compare this, because this is kind of more complicated situation. If I can't fix somebody's squat online, I'm going to send them to a personal trainer to be hands-on with them. Just like if I can't fix someone's diet from an online perspective, I'm going to have someone work with them hands-on with a doctor and make sure that they can resolve it.
Mm-hmm. Certainly. I have a friend that I hadn't seen in a while, and I think he just turned 40 a year or two ago. And he's somebody who's very cautious. He definitely likes to, get consultation when he needs it. And everybody knows that when you turn 50, you're supposed to get a colonoscopy, which is critically important. Colon cancer is the second leading cause of cancer death, and it's the most preventable. Up to 80% cure rate if you catch it early enough. If you don't, then it metastasizes like anything else, and you're just done. So early symptoms are definitely something to pay attention to. But he was 40 years old and decided, whatever, maybe his insurance company just covered if he wanted it. So he's like, well, I'll just get one anyway because I have a little family history of issues. And they caught a precancerous polyp. And I've known people who have died of colon cancer as early as in their 30s. And they said, yeah, if you had waited 10 years to the recommended age of 50, you would have had colon cancer. And, maybe you would have caught it down the road and you'd be fine or not. But at this point, it was just simply a little, basically, it's kind of a larger biopsy. Take out that polyp and you're done. But now he's aware, and if his body just naturally, produces these, if that's an issue with his DNA, his genetics, now he knows, and he'll get scoped more often and he'll be fine. So again, guys, these are things that we want to make sure that you can create any kind of a resolution that's possible through the food you're consuming, through eliminating things that may be irritating your GI system. But if you have serious symptoms, it's definitely worth getting checked.
I just remembered the name of that girl's diagnosis. It was ischemic colitis is what she had. It took me a minute. It's been quite a few years.
Mm-hmm. You know, and there are other things. You can even have nerve issues where your GI system is not innervated quite as much, and so motility goes down. Low thyroid can even do that. So all kinds of reasons to work on it yourself, take it seriously. But when you need to go that extra mile and at least have a doctor on board helping you, that's very important. So you guys stay tuned. We got one more episode to wrap this up. We want to talk about exactly what you can do to prevent all of these things. Hopefully never even have to deal with these. So we will see you next time in Contest Prep University.